Okay, definition of what is an abdominal mass? Definition, by definition, an abdominal mass is any abnormal growth that occurs within the abdomen. Okay, the abdomen can be divided into three categories. First, the anterior abdominal wall, which is the pre-peritoneal space. Okay, any tumors or growth that comes in this is also considered abdominal tumors. Then the peritoneal cavity itself, which is the intra-abdominal cavity, which is the largest space, which is lined by the peritoneal lining, two layers of the peritoneum. And thirdly is the retroperitoneal space, which I shall show you in a short while. Okay, the first one here is the peritoneal cavity, lined by the peritoneum. Okay, and these are the organs. The bulk of the organs are within this peritoneal cavity. And this is the peritoneal cavity, which I said. The second biggest space is the retroperitoneal area, that is behind the peritoneum lining and the posterior abdominal wall. And this area, the space, contains a number of very important organs as well. Aorta, the vena cava, the kidneys, the duodenum, second, third parts of the duodenum, pancreas, and the major vessels that come out from the aorta, the superior mesenteric, inferior mesenteric, and the iliac arteries. And the inferior part, the bottom part of the peritoneal space here, okay, is the pelvis, which is also seen here. The uterus, urinary bladder, prostate, all lie within the pelvis. Okay, so this is the peritoneal cavity, and this is the retroperitoneal structures. Okay, for convenience, the abdomen can be divided into four large quadrants: the right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant. And these are the structures highlighted here, which are contained within these areas. Okay, right upper quadrant is the liver, stomach, and gallbladder. The left upper quadrant mainly consists of the stomach, the spleen, and the pancreas. The right lower quadrant, the appendix, right colon and cecum, and the ovary in females. These are the important organs that are present in the right lower quadrant. The left lower quadrant is the colonic left colon, descending colon with its diverticulum and left ovary. The kidneys occupy both the right upper quadrant and the lower quadrant. So it is known as the lumbar region, which I show you in the next diagram here. Okay, the kidneys occupy here in both upper and lower quadrant on both right and left side. And the ureter runs from the upper quadrant right to the pelvis. Okay. Many people like to divide the abdomen into 9 regions, okay, as shown in this diagram. Right hypochondrial region, right epigastric region, left hypochondrial region. The middle three are the right lumbar, left lumbar, and the umbilical region. The lower three will be the right iliac region, hypogastric or suprapubic region, and the left iliac region. And the structures that lie in all these 9 regions can be seen in the diagram below this. Okay, abdominal mass must come from some organ in one of the three regions, and the most common will be the intraperitoneal cavity and the retroperitoneal space. And the organs that are in these regions, okay, give rise to these masses. So the organs of origin of abdominal masses are liver, stomach, spleen, gallbladder, kidney, colon, appendix. Also, the cecum in the ascending colon, the pancreas in the retroperitoneal space, the ovaries in the ilia, both ilia fossa and the pelvis, urinary bladder, uterus, both in the pelvis. Then the abdominal wall, anterior abdominal wall can have also be tumors masses arising there, and an important retroperitoneal area. Okay, these are the organs of origin of abdominal masses. And to be more definite, what are these masses? In the liver, you have liver abscess, enlarged liver due to hepatitis or metastatic lesions, and hepatoma. Okay, hepatoma or malignant lesion of the liver. Carcinoma of the stomach is the main cause of definite mass arising from the stomach. The gallbladder, from the gallbladder, you have the empyema, mucocele, carcinoma of the gallbladder, and the bile duct. The left colon, on the left side of the abdomen, you have the left colon, which consists mainly of the descending colon and the rectosigmoid colon. These masses arising from these colon, left-sided colon, are very important, very common. Similarly, on the right side, right colonic cancers, especially cecum and ascending colon, they also present with a mass in the right side of the abdomen, mainly in the right ilia fossa. The kidney can present as a mass in hydronephrosis, congenital polycystic kidneys, bilaterally enlarged kidneys, renal cell carcinoma, and Wilms tumors. Hydronephrosis used to be a very common cause due to blockage of the ureters by the renal stones. Appendicular mass or abscess is one of the most common masses that we see in the abdomen. Ovarian cyst, also another common cause of lesions in the right and left lower abdomen. Ovarian cyst and carcinoma in elderly, more older patients. Masses from the pancreas are usually pseudocysts of the pancreas and adenocarcinoma of the pancreas. Masses rising from this enlarged spleen can be due to portal hypertension, cirrhosis of the liver with portal hypertension, thalassemia with large kidney spleen, and lymphomas. These are the common causes of masses rising in an enlarged spleen. Okay, now how do you go about assessing or evaluating a patient who presents with a mass in the abdomen? First, like is in all cases, you go to the history to elicit the symptoms of this mass. What is the chief complaint of this mass? Okay, and once you have got the chief complaint, then you can get more details in the history of present illness. Okay, once the patient says, I've noticed a lump in the right side of my abdomen, or wherever the site may be, it's very important for you to get the details of this lump. How did it come about? The onset, acute onset, insidious onset, how many weeks or months before now, the present admission. Okay, the onset is very important. A lump that has been there for 10 years is unlikely to be a malignant lump. Whereas a lump which is there for 1 or 2 days, also unlikely to be a malignant lump. Whereas a malignant lump may be there for weeks or months. Okay, so this is very important. The onset is important. How did the patient notice the lump? The site of the lump, anatomical structure, site, okay, which are mentioned according to the either the 4 quadrants or the 9 regions of the abdomen, which I showed you just now. Site of the lump, size of the lump. What was the size initially, and what is the size now when he is in the ward? Is it growing in size? Okay, shape is very important. Okay, is it growing? How fast it is growing? The surface, how does the surface look like to the patient or feels to the patient? Any pain? Okay, pain. Did the patient realize it is mobile or pulsation? Is it pulsatile? Okay, and the consistency. These are all very important things that you must ask in the history. Then the onset and progress, which I said. The other important thing is associated presenting symptoms, especially fever, nausea, vomiting, diarrhea, bleeding, vomiting of blood, hematemesis, hematochezia. So these are all very important questions in patients with abdominal masses. Again, depends on the site of the lesion and what do you suspect the organ of origin of this mass. You ask them direct questions. Pressure symptoms are very important, especially if the lump may cause pressure symptoms in the abdomen, pressure on the aorta, pressure on the intestine causing intestinal obstruction, the mass pressing on the ureter causing ureteric obstruction and hydronephrosis. So the pressure symptoms are very important. So if there's a mass in the right lower quadrant or right iliac fossa, you have to think of all this. What are the pressure symptoms on the ureter, on the intestine, and also on the other structures surrounding it? Very important to get the pressure symptoms. Then loss of weight. Loss of weight, I think it's a very significant symptom. It's easily obtained, and it is an indicator of chronicity and also malignancy. And symptoms related to the organ of origin. So whichever organ you suspect, if the lump is in the loin region, right or left lumbar region, if you're thinking of a kidney mass, then you think of hematuria. Okay. If the lump is the epigastric region, you're thinking of a stomach lesion. Is there any vomiting? Is there any hematemesis? These are very important. Okay, so symptoms related to the organ of origin is very important. Okay, now coming to the examination. After the history, then you come to the examination. When you come to the examination, it's very important to look for, again, reconfirm the site, the actual anatomical site of the lump, of the mass. Okay, and that will give you a clue or an indication of what the organ of origin of the lump may be. Is the lump mobile? Okay, mobility is very important. Between mobility by palpation, vertical and transverse mobility is very important to determine whether it's mobile, whether it's fixed, or is it fixed to the underlying tissue or fixed to the overlying skin. Okay, and then also very important for you to know whether it is moves with respiration, mobility with respiration. Okay, in general, retroperitoneal organs do not move very well with respiration, whereas the intraperitoneal or abdominal space, intra-abdominal lumps, they move freely with respiration. For example, a lump in the liver, the enlarged gallbladder, the mass from the stomach, this moves easily or freely with respiration. So when the patient breathes in, the mass is pushed down. Okay, that is very important. Mobility with respiration. Whereas a kidney mass or a pancreatic mass is not that mobile with respiration because it is plastered down to the posterior abdominal wall. The next is pulsatile. This is a very important thing, especially if the patient is old, elderly patients, and you must think of aortic aneurysms. Pulsatile mass is very important. Okay, the most common cause of a pulsatile abdominal mass in elderly patient is aortic aneurysm. You must think pulsatile, and this pulsatile mass, you have to also at the same time you see whether it's expansile mass or is there any bruit, systolic bruit or thrill that can be palpated over this mass. Okay, these are important things that you must do when you notice the pulsatile mass. The next thing to consider is whether the lump is cystic or solid. And this can be done by the fluctuancy test. Okay, so fluctuancy test is important. You have to go back and read up and find out how do you do about whether it's a fluctuant or not. A cystic lump will be fluctuant, whereas a solid lump will not be fluctuant, and on percussion, it will be stony dull. Next is tenderness, guarding, and rebound tenderness. These are all important, especially patients the mass is infective origin, or it is ischemic or twisted, ovarian cyst, for example. So there may be tenderness, guarding, and rebound. So it is very important to look for these signs. Skin changes, especially if it is a superficial lump, maybe it's abscess or a carbuncle. So the skin changes are very important. Then the special signs will be Murphy signs, psoas test for appendicitis, and so on. These are the two common things that we do in patients with cholecystitis and psoas sign for appendicitis. Then percussion and auscultation are also equally important. Look for dullness, hyporesonance, or whether there's a bruit or systolic bruit. It suggests there's a vascular occlusion or vascular obstruction. So these are important things. So these are the things that you go about to evaluate or assess the patient who presents with a mass in the abdomen. Okay, what are the special considerations of mass? So I told you, intra and retroperitoneal masses, you must know how to differentiate between these two. Okay, intraperitoneal masses are covered with the peritoneum. Usually they are more mobile, they are in a large cavity. Okay, retroperitoneal, on the other hand, less mobile, especially with respiration and also by palpation. Okay. And if it is a mass coming out from the anterior abdominal wall muscle, for example, a lipoma or a liposarcoma that's involved in the abdominal wall, then this can be easily detected or tested by tensing the abdominal muscles. Ask the patient to lie flat and lift both his legs up with the knee straight. If it is, that means the patient is tensing the abdominal muscles, rectus muscle. If the lump is superficial to the rectus, then it is in the anterior abdominal wall. If it comes from the abdominal cavity, then on tensing the abdominal muscles, the mass becomes less prominent, okay, less visible. So that means it is deeper to the anterior abdominal wall muscles. And I already mentioned solid, cystic with a solid is very important. Okay, cyst and solid usually can be easily, in most cases, can be diagnosed by the fluctuancy test and by percussion. And the other important thing is pelvic mass. For pelvic masses, it's very important to do a vaginal examination and rectal examination. These two are very important. Apart from palpation, auscultation, and percussion, you have to also do a pelvic examination. right? If it's a female, rectal examination plus vaginal examination. If it is a male, then a rectal examination. These are very important considerations for the special tumors that I talked about. Now, what are the common causes of abdominal mass in our patients? Okay, first, the most common is appendicular mass and abscess. Okay, appendicular mass and abscess usually acute onset within a few days. There's a tender mass in the right iliac fossa, okay, which is tender, there's guarding, there's rebound tenderness. Next, we have ovarian mass, which is also very common. In female patients, you have to think of a ovarian mass, ovarian cyst, ovarian carcinoma, twisted ovarian masses, cysts. Okay, these are very important, ovarian masses. Then, cecal mass, CA of the cecum, is commonly presents as a vague mass in the right iliac fossa region. So in patients with this, you have to look for bowel changes, bowel habit changes, anemia, loss of weight, and whether there is altered bowel habits, and especially passing of blood stain or melanic stools. Okay, cecal carcinomas. Sigmoid tumors, usually fresh blood rectum, very important. They present with the mass in the left lower quadrant. Okay, so you must get the symptoms related to the sigmoid colon cancer. Carcinoma of the stomach, okay, mass in the epigastric region. Pancreatic cyst, which I mentioned, pseudocyst of the pancreas, and cancers of the pancreas, adenocarcinoma of the pancreas. Liver can be mass, can be a tumor or an abscess. Renal, again, hydronephrosis or renal cell carcinoma. And in children, you must think of Wilms tumor, okay? Nephroblastoma. In an elderly patient, think of an aortic aneurysm, a lump to the left of the midline in the abdomen, around the umbilicus, okay? Aortic aneurysm, which is usually pulsatile, and also may have a pre. From the pelvis, you have uterine lumps, fibroid, okay, masses from the uterus, especially fibroid, and urinary bladder, acute retention with distended bladder due to benign prostatic hyperplasia. Okay, this is another common thing you must be able to detect, palpate, and percuss for a urinary bladder, which will be just above the suprapubic region. And retroperitoneal tumors, they become palpable only in the later stages when they are big. Sometimes they may produce a bulge in the retroperitoneal area, in the flank area, around the region of the renal angles. There may be a swelling over the region, especially in renal cell carcinoma. Okay, so that's another important distinction. Okay, having come to a conclusion or with some differential diagnosis from the history and the physical examination, you should become a few differential diagnoses, one provisional, and next a few, 2 or 3 differential diagnoses. With this, you then go ahead to arrange or organize the investigations to either to prove or disprove whatever diagnosis that you have considered. Okay, and what are the routine tests that are used? Blood tests. Blood test is usually routine and specific. Specific for example, if the patient you suspect renal tumor or renal mass, then you have to look for hematuria. So you do a blood test, urine analysis, you will see hematuria. If the patient has got a lump in the right iliac fossa, chronic lump, okay, you're thinking of a sickle or colonic lump, then you may have to look for anemia, do hemoglobin. These are specific tests. Okay, if you think it's a tumor in the colon, then you have to look for CEA, carcinoembryonic antigen. So these are specific tests to diagnose a certain condition. Okay. Urine analysis, same thing as I mentioned. If you think it's a renal mass, you must look for blood in the urine. Okay. Imaging methods, techniques, plain X-ray of the abdomen, ultrasound scans, CT scan, MRI, and endoscopy. So in this order, most of the time you do them in this order. Plain X-ray, ultrasound will be the two preliminary or first investigations, followed by what you do next depends on whatever you see. Okay, if you suspect it's a colonic mass or a gastric mass, then you go straight for endoscopy. You think it is a soft tissue tumor somewhere, then you want to do a CT scan. Okay, so the next depends on what your preliminary investigations reveal. Next is a tissue diagnosis, biopsy, which can be under ultrasound or CT guided, or can be endoscopy. Okay, if it is a liver mass, it can be under ultrasound or CT guidance. You can do a percutaneous biopsy. Okay, whereas if it is in the bowel, then you do a endoscopic biopsy. So again, biopsy is the diagnostic test that will give you the final or diagnosis of the condition of the mass. Other special investigation, ERCP, in patients you think is obstructive jaundice, then you may want to do a ERCP. Special imaging, okay, like radioisotope, IDA scan for liver and gallbladder problems, hepatobiliary problems. So other special tests depends on what the diagnosis that you are considering in this patient. So again, important blood tests, urine, and imaging, followed by biopsy. Okay, these are some pictures to show you the various abdominal masses that we commonly see. Okay, here I've marked for you a mass in the right iliac fossa. Okay, a smooth lump here, diffuse swelling at iliac fossa. This is a patient with a appendicular mass. Okay, appendix with adhesions and all, so it's appendicular mass. This patient here has got a huge mass in the epigastric region, okay, and the right side of the abdomen. Okay, this is a patient with a large tumor in the stomach. Again, another patient with a right iliac fossa mass here, much smaller, and this patient had a abdominal or appendicular abscess, which was tender and guarded, and there was a mass with a vague margin around. This patient, epigastric mass here, this was a patient with pseudocyst of the pancreas. This is another patient with the mass. It's an elderly patient. You can see from the skin turgor wrinkles, you can see there's a mass here. This is umbilicus. This is a right iliac fossa mass, large mass, and this is the patient with the carcinoma of the cecum. So the very important location of the lump gives you an indication, the source or the organ of origin from the lump, and that will give you a differential diagnosis. Again, this woman here, a lump here, this was a appendicular mass. Okay, diffuse lump here on the right side. Other lumps that can occur in a female patient is an ovarian cyst. Okay, also, but the ovarian cyst is usually much lower here. This is slightly higher, so it's a most probably ovarian cyst, appendicular mass. If it is an older patient, I would also consider cecal carcinoma. Okay, these are some of the masses that we come across commonly in our patients. So I've just given you some guidance as to how to go about taking a history and doing a physical examination to come to a clinical diagnosis. You may go to visit the Facebook page here, the link which I've given here, where I've posted some pictures of various types of lumps that we come across in our practice. So please visit and go through those pictures which I've shown. Thank you. Till we meet again. Thank you, and we see you again.